I'm Alexandra Macarubo from BSN2B. I'm going to discuss the respiratory distress syndrome. So, what is respiratory distress syndrome? It is a respiratory difficulty caused by decrease or deficient in surfactant. The risk factor in this disease is the premature babies, wherein it is less than 37 weeks AOG and more on or high possibility na makita siya sa less than 28 weeks AOG. Is because that premature baby, meron din siyang fetal lung immaturity. It means that the patient lungs is not matured enough to have a adequate amount of surfactant in the lungs. That's why there will be a decrease in pulmonary surfactant. Surfactant in the alveolar surface. So, what is surfactant? Surfactant acts as a cushion in the pulmonary tissue that prevent the collapsing or closing of the alveoli in the alveolar surface. So, dahil mababa yung pulmosurfactant niya, it will lead to alveolar surface tension. Dahil nagkaroon ng tension sa alveoli, na-damage yung alveoli and it will leads to atelectasis. Atelectasis is collapsing or close of alveoli in every expiration. Ito yung pine-ferment ng surfactant, which is wala yung premature baby, kaya nag-lead siya sa atelectasis. This atelectasis will lead to the uneven perfusion and the hypoventilation. hypoventilation, it means that mababa na yung ventilation niya, or there is presence of impairment in ventilation. So, mataas ang CO2 niya sa lungs and mababa ang oxygen level niya sa lungs. These two will lead to hypoxemia, and hypercapnia. So, hypercapnia is CO2 retention sa blood vessel. It's because of hypoventilation. So, dahil nagkaroon ng hypoxemia and hypercapnia, magkakaroon ng respiratory acidosis. Respiratory acidosis is mas mataas na yung CO2 level niya sa blood, which is dapat na-excrete siya sa lungs. This respiratory acidosis will lead to pulmonary vasoconstriction, pulmonary vasoconstriction is the result from the alteration in the extracellular H positive concentration sa blood, and it will lead to pulmohypoperfusion, wherein this pulmonary hypoperfusion, is that mas bumaba yung oxygen level niya sa dugo na dapat nagsusupply sa lungs. And because of that, nagkaroon ng damage sa endothelial cell. Kita ba? Tama. Nagkaroon ng damage sa endothelial cell ng blood vessel surrounding the alveoli, and the epithelial cell sa alveoli mismo. So, because na-damage itong dalawa, nagkaroon ng leakage of plasma galing sa endothelial cell ng blood vessel and necrotic cell from the epithelial cell. Itong leakage na to pumunta sa alveoli, causing the formation of hyaline membrane. Hyaline membrane is composed of dead cells from the endothelial cell and protein from the alveoli. So it will lead to blockage of alveoli. Dahil nagkaroon ng blockage sa alveoli, the patient will experience difficulty in breathing dahil nagkaroon ng blockage. And cyanosis dahil there is no enough supply of oxygen in the lungs, also in the blood na surrounding the lungs. So, ayun lang yung presentation ko. Yun po.